The orange man in office has really gone too far this time. He's doing away Medicaid, SNAP is being cut off, or food stamps, and Section 8 could also be affected. And we did cover this in another video, so just check our channel on the latest videos to get updated on that. But on today's discussion, we're talking about Medicaid and some of the impacts that this could have on the hospital and the health sector. Like, is somebody overseeing what's going on right now? Because, oh my God, the Trump train is just trumping and doing what he does best. Wrecking like a wrecking ball. Am I right? But on today's discussion, we are joined by some perspectives and people that just want to shine a light on some of the discussions that are being had on Medicaid being cut and what are some of the impacts that they think are gonna affect it. Black people really told us and warned the land of the free not to bring him back, but I guess nobody listened. Let's get started and we're gonna have this breakdown discussion, so don't go anywhere.
You guys, we need to make some noise and we need to do it right now. House Republicans just released their budget resolution, and in it, they're aiming to cut Medicaid by at least $880 billion. And they want to cut SNAP, aka food stamps, by at least 20%. $880 billion. Now, where did they get that number from? Oh, well, would you look at that? It turns out $880 billion is the entire Medicaid budget, meaning this budget from House Republicans seeks to eliminate Medicaid completely. They think they could get away with this by just calling it a budget cut. We're not going to let them. We need to spread the word. We need to sound the alarm. Medicaid is such an important program that helps millions and millions of Americans. Medicaid provides coverage to eligible low-income families, pregnant women, elderly adults, people with disabilities, and so much more. And they want to strip this program away from people. By the way, remember all those times throughout the campaign where they promised they would never touch Medicaid? They would never do that. Well, they lied again like they always lie. So folks, I know so many people who rely on Medicaid, so I'm counting on you to get this message out. Do not let them do this, because if they get this budget to the floor, they're going to be able to pass this through a process called budget reconciliation. That means they could pass this without even having to worry about the filibuster. They could just pass it, push it through with a simple majority, meaning all it takes is the Republicans to push this through and ruin millions of Americans' lives. And by the way, at the same time they're doing this, they are trying to pass a $4.5 trillion tax cut for billionaires. Spread this far and wide, folks. And if you appreciate these updates, remember to add the Midas Touch podcast on Apple Podcasts and Spotify.
I don't think a lot of people understand the volume of people that are going to die if Medicaid gets taken away. That means elderly people who use Medicaid to pay for their nursing home. I guess they're just going to throw them out onto the street. I'm not quite sure how that's going to work. That means people who use Medicaid to pay for their chemotherapy can no longer access it. That means people who use Medicaid to pay for their diabetes care no longer can access it. And that means that I think it's 4 out of 10 births in America not going to be covered anymore, because 4 out of every 10 births is paid for by Medicaid. And one thing that I don't see a lot of people talking about is the people who are not on Medicaid yet, but would need to access it in the future. Because those people, you've already signed their death sentence as well. There are a lot of people in this country who have stayed with abusive family members or stayed with abusive partners because they need financial assistance, and going out on their own, they can't afford it. When you take away safety nets like Medicaid, guess what? You're signing their death warrant, because then they're in the position of, do I stay and have access to private insurance, but maybe die by the hands of my abuser or through negligence of my family members who are supposed to be my caretakers? Or do I go out on my own where I can afford nothing, not housing, not food, and definitely not medical care, and then just that way?
Hey, well, he's getting rid of Medicaid. And here in this very poor, very red state that I live in, Medicaid is under a program called TennCare. That's our version of Medicaid. And it's 65% federally funded. So when that money's gone, a bunch of you all are going to be dropped from TennCare. I hope they keep kids covered. But the rest of you, you're going to be in my world. Either you're going to have to pay for coverage, or you're not going to have insurance, and you just hope you don't get sick. Yep, I've listened to you sing the praises of Trump while getting your TennCare. I've heard you talk about Biden while you got your TennCare. Well, to use one of your all's favorite little sayings, you're getting ready to find out, because Daddy's home.
Republicans in Congress are looking to eliminate Medicaid and food stamps. After reading their plan to cut $880 billion, I looked up to see how much money is allocated to Medicaid. It's $880 billion. And on top of that, they plan to cut SNAP by at least 20%. This is going to affect seniors, 50% of all American children, the disabled, and rural communities. Republicans tried this in 2016 during Trump's first election, but were unsuccessful due to public outrage. And now, they're trying again. All of this, what's the reason for it? To give tax breaks to the ultra-wealthy. Like, save, repost, comment your thoughts below, and of course follow for more updates. This is Nell, Double Amputee.
It's your friendly reminder that cutting money from the Medicaid budget is not going to help to decrease the amount of abuse and fraud. Ideally, you would want to actually increase the budget or reappropriate funds within that budget towards catching abuse and fraud. All that cutting the budget does is decrease the amount of resource and funding that people have access to. The population that is going to be the most affected by this are children with complex medical needs, chronic conditions, and disability. I work in the PICU, and almost all of my friends that have complex medical needs, chronic conditions, or disabilities are on Medicaid. So cutting funding to Medicaid only decreases the amount of vital care that they can receive. And these budget cuts are not meant to benefit you. Okay, we've already seen the tax plan. Your taxes are going to go up if you make under $400,000 a year. These tax cuts are meant to benefit the tax cuts that are going to the ultra wealthy. Even with these budget cuts, the fraud and abuse is going to continue to happen. Even though it is so negligible, it's barely an issue. It is going to cause people who really need it to lose out on vital resources.
So when Orange Man takes away all of Medicaid and all of these community mental health centers are closing, what are we doing as professionals for, like, I don't know, a huge percentage of people? Because I've worked in those centers for years, and like there are waiting lists, and like kids depend on those services, adults depend on those services, and they depend on those services because they can't otherwise afford them. So like, are we just letting them go into society and withdraw from medication and like totally just go to the prison system? Is that the plan? Are we like supposed to absorb them into private practices and like expect them to pay money that they don't have? I like just literally don't understand. And like, we can't get money from the government to help take care of them, or like grants or anything like that. So, and like, you guys are all about like, don't abort babies, but then who's taking care of these babies when they're born into houses that can't take care of them? The community mental health centers that you would like to close.
So they're legit gonna try to cut Medicaid out. You know, they're legit gonna try to cut Medicaid to pay for the tax cuts. So just FYI, for those right wingers that might be listening that go, good, we need to cut off the freeloaders. 40% roughly of Medicaid recipients are children. Either children with disabilities, children of single parents, households, low income, stuff like that. So you're talking about taking away healthcare for millions of children. The rest of the people that are on Medicaid are seniors, low income people, and disabled people, right, because of a lack of affordable health care. But that would honestly be a form of socioeconomic straight up class warfare. Kill the disabled, kill off the poor, kill off the old and poor, and these are the same people that don't want to feed kids at school. They don't want kids to have health care. They're just deplorable goals on the conservative side. But they don't understand they can't see the forest for the trees. They're over there cheering on, yeah, get rid of all the freeloaders. Okay. Then you don't know how the healthcare system works. Our system is built on itself, right? So we have Medicare, Medicaid, private insurance, all this stuff. Medicaid has about $880 billion in budget. You don't think that people losing their Medicaid is also going to have a ripple effect on the economy? You're talking about hospitals possibly closing, nursing facilities and rehabilitation facilities and special treatment centers that rely on this Medicaid funding to pay for claims, pay for their facilities, pay for their employees. You're talking about mass unemployment, hospitals closing. You people have it's either this, either you're evil or you truly didn't understand what you voted for.
Now, let's just shine a light on the comments and some of the thoughts that people had concerning Medicaid being cut off and food stamps as well. So what do people think in the comment section of one of the videos that we just watched? So let me read you the first comment, and it reads, I am already looking for a new job. I'm a pediatric home health nurse. All my patients are on Medicaid and no insurance. I can't see them anymore. I am worried for these kids. Oh my goodness. So that's a nurse right there that is just really worried for their patients. And the other one is, this is sad. Social Security might be next. So that's a comment right there. And the other one says, I fully believe those who voted for Trump truly want everyone to suffer because of the same system that failed them. They don't want resources for others. So this is somebody that is convinced that they brought him back to make others suffer. The comments continue, yet everyone keeps posting to get more likes and views. Okay, so this is another comment just talking about how people are keeping on posting. I think people are just posting to keep us updated, you know. The other comment says, I hate it here. I voted for Kamala and we still got this dictator clown. That's another comment that suggests they voted for Kamala but got something else. Another one says, no, they thought they were targeting immigrants. Surprise, surprise. And to add this, we know who uses those benefits the most. Yeah, we know who uses those benefits the most, and we're going to talk about that as well. The other comment says 20% of America relies on Medicaid. This is mass unaliving. What happens to people receiving life-saving medicine or treatments? I feel sick. Oh my goodness. The other comment says it's not that they voted to be on the winning end, but wanting everyone else to lose. So this suggests that people just voted not to win, but they just didn't want Kamala to win so much that they just ended up making everybody else suffer. Now, the other one says, majority of nursing home patients are on Medicaid. Will MAGA finally wake up with their granny passes? Part of me thinks not. Wait, is there actual confirmation stating that Medicaid is going to be gone? Well, we're going to get into this discussion because some commenters don't really think there's actual confirmation out there, and that's a really good sign that we should break this video down. But let me just talk about the fact that I recently watched the movie Joker, and I know this is not a movie or a joke, but in the movie Joker 2019, he's kind of like medicine, sort of like Medicaid was cut off, and he started going insane because he had this psychological illness, right? And this illness started eating him alive. Hence, we had the Joker, the villain that we all know as the Joker. Now, the reason why I'm citing this is, what if people that were receiving treatment start also just behaving in a way like we saw the Joker behaving in that movie? Because that guy really had some mental issues, and cutting off his medicine that was sustaining him kind of like made him the villain that he became, you know. So I just hope this whole situation doesn't escalate to the point where people just get berserk, crazy, and start behaving irrational. But let's get down to business and the breakdown that suggests Medicaid might be cut off. Now, this report is written, hospitals, physicians urge Congress to reject cuts to Medicaid. All right, so if hospitals and physicians are kind of like telling Congress not to do this, then you know it's serious. So the American Hospital Association and several physician groups are urging Congress to reject cuts to Medicaid in proposed budget resolution. So why are they saying this? So the AHA or AHA said even a small portion of the proposed cuts would destabilize hospitals and health systems. So this one is saying that don't even put the whole amount into consideration, but just a little cut to the full budget could disrupt the entire system. So if a physician is saying this, then you know that stuff has really hit the fan. So the other one says slashing already low Medicaid payment rates would make it harder for physicians to provide care to people covered under Medicaid and would ultimately increase healthcare costs as patients are forced to forego vital preventive care, physician groups said. There are a lot of serious implications attached to cutting this aspect of the people's livelihood. On Wednesday, House Republicans released a budget resolution for fiscal year 2025 that instructs 7 committees to come up $1.5 trillion in mandatory cuts over 10 years. So that's the target in 10 years that they just want to cut. Like they don't want to see that going into all these things anymore. Now, the bill instructs the House Energy and Commerce Committee, which has jurisdiction over a number of healthcare programs, including Medicaid, to cut mandatory spending in healthcare by no less than $808 billion, according to AHA. Now, the thing is that this $880 billion is the actual budget required for Medicaid to function accordingly. So targeting that specific number could actually mean a disruption to this specific area of the health system. And that's the reason why people are very, very concerned. So you tell me, is this a confirmation? And before proceeding, I just want to talk about the fact that I thought rolling back on DEI was going to affect black people only. But that's not the case, as we've seen a lot of palm-coloreds, especially palm-colored women, just being unemployed and getting the boot from their workplace. So that suggests that rolling back on DEI wasn't only going to affect marginalized communities as well as black communities, but some of these initiatives that are being cut off are actually going to end up affecting palm-coloreds as well. And it could be the majority of them because they never anticipated that. But even the farmers are getting affected. So just think about it in that sense. And to finally just conclude it all, I just want to go back to the aspect, or rather the advice that we were seeing in 2024 from the black community. Do you remember that time when we had the campaigns? Kamala had her own campaign, and a lot of people were just against her. And I remember a lot of immigrants, a lot of people from the Hispanic community, like during those rallies. I just remember everything that was going on. They were saying that she's a bad person and they're not gonna vote for her. Like, I think that's where the anger really came from when it comes to the Trump train coming back in office, because most people just wanted to prove the black community wrong, even if they knew that this was a fact and the truth that they were getting from the other side. But they didn't want to hear the words of the black community because they thought that black people were no longer in solidarity with them. You remember the watermelon community during those things that were going on, they wanted black people to help them. But we were seeing that the watermelon community wasn't bringing awareness to the issues that are affecting black people all over the world, including Congo. So black people also started just calling on them, asking them to address these issues. And then we saw the tensions escalate. I remember that. And I think that's where majority of the things that we're seeing right now really came from. People didn't want to take black people's words because of that aspect of what happened. But with that being said, we've come to the end of our discussion. And if you would like to enlighten us more, just leave your own thoughts down in the comment section and let us know what you think about today's discussion. And FAFO season continues, as always.